Hey guys, it's Sam again. So we got another video today, as if you haven't heard my voice enough. We're going to be talking about circle priming and the steps to do that. I've had a lot of questions on this the past few weeks because we've been doing it more and more frequently with different hazardous drugs. So I'm going to be coming up with a class on hazardous drugs administration and circle priming, but in the interim, I just wanted to make this video and kind of have a setup in the procedure room for you guys in case you wanted to kind of mess around with it. So, some things you're going to need to circle prime. First off, your protective equipment. You want to have a blue gown. We don't have any down here right now, but the specific things about the blue gown needs to tie in the back and then also have those cinch wrist cuffs. You can't just use a regular isolation gown. It's not the same. So make sure you have those. If we don't have those down here, I'm going to look into how we get them. But if we don't, Faux has some. The other thing is your chemo gloves. So we do have boxes of these down here. We call them chemo gloves, but we use them for any hazardous medications. Those are really important to have. Also, having your chemo bin is really important. You want to put anything that comes in contact with potentially hazardous medication. That includes drugs, that includes any vials, that includes diapers, anything like that all needs to go in here. And then you've got we're going to pretend like this is our hazardous medication. You've got your drug, you've got your tubing. I will say some medications come up with specialized tubing to help with absorption, but we're just going to use regular tubing for today. You need your face seal, which we don't have these on the floor currently, but HEMOC also has these. Your face seal, and then this is the connector for your face seal, and this is what connects the face seal to the IV. Last thing is your clamp. So your clamp is used to go over the face seal so that they don't become disconnected, because I know we've had a lot of kids with that before. So when you're getting ready to start, you're going to put your chemo gloves on. And I will tell you a little fun fact. They are labeled right and left. So if you put them on the wrong hand, your hand's going to hurt. So put them on the right hand. And then I always tell people, you want to spike your medication beneath you. You don't want to spike it up here and then potentially expose yourself to all that hazardous medication. So I'm going to get your tubing out, get it ready. So I'm very cautious, so because of that, I always clamp every piece of my tubing that I can, just in case in the off chance that something goes wrong. You don't want to empty that bag of hazardous medication all over the place. So, I know you can't really see this, but really I would leave this on my cart, and I would spike it like this. So you're going to spike this just like any other med you would, just beneath you. So once you spike it and you're good to go, you can actually put it up on the pole. Bring it a little bit closer to you here. So this is going to be hard to simulate because I don't have a bag that has a face seal connector in it. But if I did, I'd be able to show you. But for the purposes, we're just going to simulate. So this face seal portion goes on the bottom end of the tubing here. So I'm going to take the cap off. You're going to connect this here. Now, one thing I want to caution you, make sure that this connection is really tight because you don't want this to come disconnected and the face seal to still be open because the person could potentially bleed out that way depending on what kind of line you have. So you got your face seal on the end here. So let's say we're going to simulate that we have a port on the other side here. So what you're going to do is, let me see if I can kind of show you this. These fit in like this, fit in like that, and then what you have to do is turn, so you have to kind of turn it counterclockwise, push it in. When it's pushed in like this means that the face seal is activated. If it's out like this, it's closed off, so no fluid's going to be going through this. So let's say we hook it up to our bag, and we push it in. So remember, our tubing is clamped, which that's a good thing. But the first thing you want to do is you want to put fluid in your chamber just like you would any other infusion. And then making sure this is pushed in, you want to prime your tubing. As you can see, it's priming slowly. One thing I want to caution you, sometimes when you're priming, your fluid will actually decrease up here. You want to make sure you continuously are pushing to make sure there's enough fluid, it doesn't suck any air, because sometimes that does happen. So we're going to prime our tubing all the way up here to the top. Get all the bubbles out. Sometimes you have to flick a little bit, get the bubbles out. So with this in the bag, it's going to prime it back up into the bag. So there's no risk of contaminating yourself. It's actually safer for us. Once you've primed it, I usually will take it out like that and kind of leave it attached to the bag until you're ready to put it on the patient. So with that, you're going to disconnect it from the bag. You've got your open face seal. Now this doesn't connect to the IV, right? So that's where our lure lock connector comes in. So you're going to, again, same deal, push this in. Turn clockwise, and then you would push it in if you're ready to give the medication. Sorry, you can't see that. So again, to connect it, and this is the same for the bag, you're going to push it to where those little things line up. You're going to turn it clockwise. It's kind of a little finagly a little bit, so, and then push it in. And that's when you're open through here. So if I was going to connect it to the patient, I would first, flush the IV, make sure it's good. If the IV is good, then I would go ahead and hook this up. With our patients, we're not always going to have blood return. It's best if you do have blood return, but if you don't, you got to kind of work with what you got. So just keep a close eye on that IV. Always give it a good flush beforehand. So you're going to connect this, and when you're ready to give the drug, you're going to push this in. You're going to program your pump and start it. Then, when you've kind of got it figured out here, this is where this clamp piece comes in. So you see the face seal kind of fits in there perfectly. You're going to close that, and you're going to clamp it. That keeps anybody from, messing with it or anything like that.